Of course I can. But not only will I talk about the injection that you were given, but let's talk about all of the medicines that we can give if you begin to have a postpartum hemorrhage or if you're bleeding faster than we like. Okay, so standard in the active management of the third stage, aka after your baby's birth, would be giving oxytocin or Pitocin via your IV. Now, this bolus helps your uterus to contract down to not bleed as much. Pitocin is a fickle thing because if we use it a lot while you're in labor, it can actually put you at more risk of bleeding. But when we use it after your baby is birthed, it prevents hemorrhage. So, Pitocin after your baby is born is evidence-based to prevent postpartum hemorrhage and also treat postpartum hemorrhage once it's started. Okay, now the reason that's standard is because if and when you begin to bleed, your uterus is pumping out so much blood so quickly that if we wait to start that until after we see that you're bleeding a lot, you can already have lost a lot of blood. So we like to prevent it with the Pitocin. But let's say we've given that and you're still bleeding, okay? One of the next ones that they may reach for is a medicine called misoprostol or Cytotec. This is also a medicine that we can give in order to induce your labor. It's a cervical ripener, but it's a prostaglandin that can encourage your uterus to contract down. Now, if we're inducing you, we're going to use little teeny tiny bits of it, okay? Like quarter of a pill, half of a pill, that kind of stuff. But if you are having a hemorrhage, we're going to use 4 or 5 of those tablets right up the booty hole normally. Why? Because it works in your butthole. I'm sorry about that. My apologies. But using a Cytotec as a suppository can encourage your uterus to knock it off. Okay, next on the list, but also maybe given in conjunction with all these other things while those things are happening also, is a wonderful medicine called TXA, or tranexamic acid. Now, TXA is a beautiful thing because it works differently than the other medicines that we're given to try to encourage your uterus to contract. TXA actually prevents the breakdown of fibrin, which can clot your blood. So basically, it helps your blood to be able to clot itself. We give a gram of that via IV very quickly, and that can be working while we're doing other things. Now, while we're doing all these things, we gotta figure out, why are you bleeding, right? Is it your uterus being a tired girl? Is she tired and she's not wanting to do this? Do you have a cervical laceration that's bleeding? Because that can bleed a lot. Do you have a tear down there in another spot that's bleeding a lot? And we may be doing other things like making sure that there's no placenta left in you, because if there's a little bit of placenta or membranes that are still in your uterus, that can cause the bleeding. But we're going to be doing other things like uterine massage, Jada, those kind of things to see if we can get it to stop in those ways. Now, number next is a medicine called Methergin. Now, Methergin is a refrigerated medication, and we give 0.2 milligrams via an intramuscular injection, usually in your leg. And this medicine works to help your uterus to contract. It works on that smooth muscle of your uterus. Now, Methergin, we would give that cautiously. We try not to give it in people who have blood pressure issues because it can cause your blood pressure to increase a little bit. The way I remember this is Methergin. You don't want to give meth to somebody who has high blood pressure. It's not meth, but you know what I'm saying? That's how I remember it. Now, number next is a medicine that is never any nurse's favorite, and that is a medicine called Carboprost or Hemabate. It is also a refrigerated medication. We give 250 micrograms of it via injection in your muscle. The reason that it's not ever a nurse's favorite is the same reason that it would not be your favorite either, and that is because it can cause extreme diarrhea. So anytime we're giving Hemabate, we're always saying, and Lamodal, to the doctor, because Lamodal is a medicine that can help you not have diarrhea so bad. So we want to give it together to help you in your poor booty hole. So Hemabate works similarly to like Cytotec and Methergin, probably more similar to the Cytotec. It's a synthetic prostaglandin that can help your uterus to contract and stop bleeding. In my experience, Hemabate is probably one of the last ones that we would use because of the diarrhea. Now, Hemabate is something that we want to give cautiously or not at all to people who have asthma. Now, that is because a rare side effect of Hemabate is something called a bronchospasm. Basically, think of it as just like hard to breathe, okay? And somebody's already got trouble breathing, we don't want to double dip it, you know? Now, the way that I remember that I don't want to give my patients who have breathing problems hemabate is because I think bated breath, don't do it, you know? That's how I got through nursing school, is I'd make up these little like word riddles or puzzles, and it would help me to remember the important contraindications for drugs. Now, if you are a nurse watching this, I want you to remember that if you ever have anything in a vial during a postpartum hemorrhage, it's not going in the IV, okay? If you're drawing it up from a vial, it is going in a shot in the muscle, usually in the leg. The only meds that you are going to be giving IV is the Pitocin, which already is in an IV bag, so that's easy to remember. TXA, which is already in an IV bag, so that's easy to remember, okay? We are not giving Hemabate or Methergin IV. Got it? Okay, good. What else? If your patient doesn't have an IV, you can give oxytocin or Pitocin in a shot, IM. But if your patient is hemorrhaging, please, dear Jesus, that's the first thing you need to be thinking is I need an IV or two. And it can be very tricky to get an IV in somebody who is bleeding because all of your vessels are going to shunt that blood to your core, and your arms and your legs and everything else ain't gonna have nothing to stick. Which is why I am a fan of an IV, even if it's just like a saline lock, just a little port in your arm when we have good veins. Because when we need it, your veins are not going to be kind to me, okay? Your veins do not give two craps, but I am looking for them. They have hidden. They are running away because they said, we got to keep this blood here, not in your arms. What else? What kind of questions you got about that?